Israel said that it had barred entry to Gaza of foreign medical and humanitarian staff whose organizations were ordered to cease operations unless they register employee details with Israeli authorities and meet other new rules.
Israel said on Thursday it had barred entry to Gaza of foreign medical and humanitarian staff from organizations that had not registered their employees with Israeli authorities. Israel has ordered 37 international non-governmental organizations to halt work, despite the humanitarian needs of the war-shattered enclave. 3 of the aid groups said their foreign staff were told by Israeli authorities this week they could not enter Gaza. Israel's diaspora ministry, which manages the registration process, said the measures were meant to prevent diversions of aid by Palestinian armed groups and will not affect, quote, approximately 99% of overall humanitarian aid. 2 aid sources told Reuters some groups are weighing whether to submit staff names to Israeli authorities. But NGOs say sharing staff details poses a risk, pointing to the hundreds of aid workers who were killed or injured during the 2-year Gaza war.
And that for Médicos del Mundo and for many other NGOs is a red line.
Eliana Olenzola is the director of international programs at Médicos del Mundo, based in Madrid.
We have the obligation to guarantee the security of our teams and, of course, to comply with the European data protection regulation. So in that case, we could not share this list.
The diaspora ministry said that while the NGOs have been granted 60 days to conclude operations, quote, the entry of foreign personnel into Gaza is not approved. It said international staff with, quote, approved organizations, including the United Nations, could continue work as usual. Israel's government said some 23 aid groups had agreed to the new registration rules, meaning humanitarian goods will continue to get into Gaza. Israel accuses Hamas and other armed groups of stealing aid meant for Palestinians in Gaza. Israel has shared little evidence of aid being diverted in the Palestinian enclave. Foreign aid staff had generally been permitted to rotate in and out of Gaza since the start of the war.
This is a potential real problem.
Anna Halford is a Gaza emergency coordinator at Médecins Sans Frontières in Deir el-Balah.
How do we get stuff into Israel and across to Kerem Shalom if we're not allowed to be present in Israel?
MSF bolsters 6 Gaza Health Ministry hospitals and runs 2 field hospitals. The Médicos del Mundo NGO screens Gaza residents for malnutrition and provides mental health services. The head of Gaza's Al-Shifa hospital told Reuters the banning of groups like MSF could affect hundreds of thousands of people. One of the groups facing a ban is Oxfam, on which thousands of desperate Gazans, including Samira Al-Ashkar, have come to depend.
احنا كنا معتمدين على المؤسسات كتير من ناحية الأكل والمشرب.
We were heavily reliant on the institutions in terms of food and drinks. We needed them for our children. Milk, diapers, sugar, cooking oil, flour. We needed them so much. Now, after the war, everything is missing, and things have become dire. We were very dependent on Oxfam. It helped us with so many things.